I'm Dr. Anthony Levenda. I specialize in orthopedics, fellowship trained in sports medicine and shoulder and knee reconstruction. I went to medical school at Indiana University. I've been with Lakeshore Bone and Joint for over 9 years. Medicine was an easy decision for me growing up. Initially, I was contemplating going into education, following in my family members' footsteps. But with medicine, I'm able to educate the patient as well as be more hands-on. My practice primarily focuses on sports medicine, primarily of the shoulder and knee. In the knee, that includes ACL reconstructions, meniscal work, cartilage pathology like cartilage defects. In the shoulder, rotator cuff pathology including tears or partial tears, labral tears, instability, cartilage injuries, AC joint reconstruction. Well, when a patient comes and sees me, I look at the individual patient. Whether it's their shoulder, knee, ankle, hip, I'm looking at the patient and how we should treat that patient. Not every patient with a rotator cuff tear is going to be treated the same. I will evaluate the patient, evaluate their MRIs, radiographs, and also discuss what they are looking for. Sometimes a rotator cuff tear doesn't need surgery. Sometimes it can be treated non-operatively, and we needed to have that discussion with the patient. In addition to that, I work closely with physical therapy, whether they're through our office or outside our office. I have a direct connection to them so that we can improve the patient's quality of life. And I think that's an important part that I offer in my practice. For example, a patient presents to my office with an anterior cruciate ligament tear or ACL tear. Depending on their age, activity level will determine what treatment options we offer. If it's a 16-year-old soccer player, male or female, and they would continue playing soccer at a high level, most likely we're going to recommend ACL reconstruction. An older patient, perhaps 50-year-old, enjoys golfing or taking walks or maybe biking, may not need their anterior cruciate ligament. So maybe we can guide them in a non-operative management. Generally, patients come and see me when they notice something's wrong. For an athlete, they're used to having bumps and bruises, maybe some aches and pains, sprains, but when they're on the field, they feel a pop, immediate swelling, inability to weight bear, just something out of the ordinary. I think it's important to come and be evaluated by an orthopedic surgeon. Many times the athletic trainer at the school or a coach will recommend that, and I think you should follow those guidelines. Similar with the shoulder. If you feel a pop or inability to lift your arm or numbness and tingling, those are things that should be evaluated, even if it's for a peace of mind. Many patients come in with chronic problems and it's a change in their normal routine. We're here to help you and evaluate you and make recommendations and most importantly, continue being active in your life. What I really enjoy about my practice in sports medicine, shoulder and knee reconstruction is being able to make a difference in someone's life. That does sound cliche, but it's true. Many of my family members are teachers, and they make a difference. I have my favorite teachers I can still remember to this day. I have that ability to do that with my patients, not only educate them, but maybe help them improve their quality of life after an injury. Taking them through that injury, whether with surgery or not surgery, formal therapy, educating them how they can improve by doing activities at home and returning to their normal life, whether that's on the football field, holding their grandkids, or even returning to a job after a work injury and being able to go back to work, do the job they did prior to the injury and provide for their family. That's really important to me, and when I see those patients out in the community and they say thank you, that means more to me than anything. In addition to having a busy orthopedic practice, I also enjoy spending a lot of time with my family. I think that's very important, also being involved in things they enjoy doing. I continue to be involved in both my son and daughter's sports. I've been able to coach my son in baseball since he started at the age of 5. Personally, I enjoy running, fishing, hiking, any outdoor sports. I'm also involved in my community. I'm the head team physician for Valparaiso University. I also am a head team physician for many of the schools in Porter County. I think LBJI stands alone in the ability to not only have exceptional orthopedic surgeons, but to treat the patient. We have other areas of medicine that other practices don't have, including rheumatology, pain management. We have a psychologist available that works with us closely, which I use quite a bit for athletes. When an athlete has an injury, sometimes it's difficult for them to adapt and to be able to take time off from their sport and to recover. And sometimes speaking with someone is very beneficial. In addition to that, I think we speak to one another, the doctors, closely so that we're treating the patient. So not only does the patient have a knee injury, maybe they have a hand injury as well. So we're very close in how we treat the patient. My philosophy for workers' compensation is very similar to my philosophy in sports medicine. When a worker is injured at work, just like an athlete's injured on the field, they'll be evaluated for any condition or injury they have. When I return a patient back to work, my philosophy is return them back as quickly but as safely as you can. Many times I'm able to return a patient back without any restrictions and they can go back to full duty. But if they do require restrictions, I will do that. I don't believe in keeping a patient off work just for the fact of keeping them off work. I think it's very important, not only physically but emotionally, to have a patient return to the activities they enjoy or do on a daily basis. If you have an injury and you believe you need orthopedic care, you can contact me at the number